Hey, y'all. Welcome to the BIRTHFIT podcast. This is episode number 256. And today we're going to be talking about a bit of a heavy topic and also something necessary. We absolutely need to talk about this. Um, and I'll just get right into it. We're going to be talking about first trimester miscarriage. And by the end of this, I want you to have some numbers, some stats, some facts, and some options. Whether you are a mama that is listening to this and you're currently going through a miscarriage, I want you to know there are options out there. Um, if you are a coach listening to this, I want you to know there are options out there and that exercise does not cause miscarriage. And if you're a practitioner, I want you to be able to share options with your clients. All right. Now, let me just jump right in. So, this topic touches everyone, y'all. Yet, it is a topic that is often silenced or misunderstood. And, whether you're a coach supporting clients through pregnancy or a practitioner holding space for women or a mama navigating your own journey, this conversation absolutely matters because statistics tell us that somewhere around 12 to 20% of recognized pregnancies end in a miscarriage, most in the first trimester. That means, just let's break that down a little bit. Let's reflect on that. If you haven't experienced a miscarriage yourself, you almost certainly know someone who has. And I mentioned the word, or I said the word recognized pregnancies. This number, this miscarriage rate could be higher, um, basically because we don't know about the pregnancies that are not reported. So, first trimester miscarriage, like I said, we often don't talk about it. We often don't share the data. We don't dispel the myths. And we don't always inform or offer women this full spectrum of options and support that they deserve. So, by the end of this episode, I want that to change. I want you to be somebody in your community that shares the whole picture, options. And what I mean by this is because too often I hear, oh, I'm going through a miscarriage. I got to go get a D&C. No, that's not the only option. And I share that as a woman that has gone through a miscarriage on my own. And I did not once step foot inside the Western medical system. I did not do a D&C. I allowed the pregnancy to release on its own. And we'll get into that in a little bit. I also, we'll get into that in a little bit, but also, let me just share this. My first pregnancy, so the minute my now husband and I decided we were open to children, we got pregnant on the first try. So we're like, oh my God, this works. And that pregnancy is the one that ended in a miscarriage. So I did not share about that miscarriage on social media or anything until late, like years later, a couple years down the road, two at least, because for the same reason I'm sharing this podcast now, miscarriage often gets a negative stigma. Women that have had a miscarriage, they become labeled as infertile. And I did not want any of those labels or anything around me. I did not want them interfering with the positive energy, the life that I've been manifesting and continue to manifest and to be in action around. So it's totally up to you how you share your journey and with who you share your journey with. There are definitely people that were in my immediate circle on my health team that knew about my experience and I turned to them, but it's not something I broadcasted on the internets. Yeah, so let's get into it even more. Let's dive in. All right, so as I said, the number is somewhere between 12 and 20% of recognized pregnancies that end in a miscarriage, and most of them in the first trimester. Globally, that's about 12.7% of recognized pregnancies. In the United States, it's about 12.8%. But as I said, these are recognized pregnancy where the number may actually be higher um, when very early losses are included and not reported. Now, let's talk about age for a second. For women ages 25 through 29, the risk is lowest, around 10%. Around age 35, that risk climbs to about 20%. Around age 40, that risk is about 40%. And women 45 and over, it reaches about 53%. Let me clean my glasses. So age does, I don't want to say it influences miscarriage, but it's more common as you age. And we'll get into that in just a second. But the good news is risk drops significantly as the pregnancy progresses. So in weeks 1 through 4, the risk is about 10 to 25%. Weeks 5 through 8, it's about 5 to 10%. Weeks 9 through 12 drops 3 to 5%. That's a big drop, y'all. And then as you get out of the first trimester, somewhere around 12 to 13 weeks, the remaining risk is 1 to 2%. Ooh, okay. Hold on just a second. I got a text I got to tend to. Okay, we're back. Okay, so as pregnancy progresses, the risk drops. Now, Western medicine and research attribute the age-related increase to the declining number in eggs and egg qualities. Now, I don't necessarily think this is the whole story, nor do I believe that is that with a period at the end. And I'm just going to take that. As somebody that got pregnant at 40 years old and somebody that has significantly increased my health, my well-being, my quality of life, I know that the quality of my eggs significantly increased compared to Lindsay, party girl in her 20s. Okay. So there is definitely going to be some validity to that, but I believe there's more research to be done because when we adjust lifestyle habits to enhance our own mitochondria, like mitochondria, the cellular level, like we're talking really small. And this is done by optimizing circadian rhythms, managing our stress levels, nourishing our bodies, like really nourishing our bodies so that our nervous system feels safe. Our health and vitality are often restored in remarkable ways. Y'all, I've seen this happen. And then I want to share this question from a colleague of mine, Carly Ray Budry. What if we do not understand the ovaries because the current system never intended for women to understand them? Some fun food for thought there. That question sits with me, y'all. All right, so what actually causes miscarriage? So most first trimester miscarriages, roughly 50% or more, happen because of chromosomal abnormalities in the embryo. This is a random genetic error, like a random just input from the system that occurs at conception, and it's not because of something you did or did not do. Let me repeat that. It is not because of something you did or did not do. They're not typically inherited, and they're not related to your actions, your stress levels, or your worthiness. I know it is very common and easy for women to beat themselves up. Please let that go. You are a vessel. You're carrying the spirit for however long their journey is. God chose women to be the vessel because you can handle this. I know the heaviness of a miscarriage. I also know it taught me to build trust back into my body and to trust in God's divine plan. Other contributing factors for miscarriage include uncontrolled health conditions. So this is where, I get really frustrated with fertility clinics that offer nothing as far as lifestyle practices, looking at underlying metabolic issues, and they go straight to pharmaceuticals Because if we look at other contributing factors like comorbidities, such as diabetes, thyroid disease, severe hypertension, we got blood clotting disorders, maybe there's some uterine structural issues, maybe there's certain infections, and then obviously specific lifestyle factors like if there's heavy smoking or high alcohol intake. All of these need to be addressed before. And this is what I'm talking about in our preconception workshop this week. The low-hanging fruit that is lifestyle habits, lifestyle practices. We're going to be talking about the 7 pillars. We're going to be talking about menstrual cycle basics, because I guarantee if you're a coach and you don't know menstrual cycle basics, you need to. If you don't know the common, let's say the 5 common troubleshooting things you need to like that show up with a cycle, learn that. Like, this is low-hanging fruit. And none of this requires you to have the ability to run labs, write a prescription, none of that. This is like basic information on how to be in a female body, how to optimize biology so that we can enhance our fertility and thereby release the most optimal egg available when we ovulate. So lifestyle habits. Our preconception workshop happening this week. If you're listening to this late, sorry about that. Get in the BIRTHFIT coach course, because that's where we talk about it. So here we go. Before we move on, we need to be very crystal clear about one thing. And this is for every mama who's blamed herself, every coach who's hesitated to program certain movements or just be a coach at all. This is for every practitioner who's played it safe by telling women to stop exercising. And what we need to be clear about is exercising does not cause miscarriage. This myth needs to die right here with this podcast. Current evidence overwhelmingly shows that normal, light to moderate exercise does not cause miscarriage in healthy pregnancies. So that's the overwhelming evidence that light to moderate exercise does not cause miscarriage in healthy pregnancies. Like, there's large systemic reviews, randomized trials, professional guidelines, all confirm this. So if your practitioner or doctor or midwife or whoever you're working with or referring to blames exercise, they are not practicing evidence-based care. Now, I know some of y'all listening are like high intensity intervals, big lifting, and there's good news. We'll get into that in a little bit. I'm just talking about the overwhelming evidence that's already out there. A 2023 systemic review and meta-analysis found no significant increase in miscarriage among people who exercised versus those who did not. Studies examining up to 7+ hours per week of typical aerobic exercise found no link to first trimester loss. ACOG, which is the American College of Obstetricians and Gynecologists, which is a professional organization that usually has an opinion about something that I don't agree with, but here they explicitly state that regular physical activity does not increase miscarriage risk in healthy pregnancies. Now, here we go. Dr. Margie Davenport, she's a Canadian researcher that's been just like crushing it with groundbreaking research. She's been instrumental in shifting this conversation. Her major systematic, all my words get run together. Her major systematic review found that prenatal exercise actually reduces the odds of gestational diabetes and hypertensive disorders, with no increased risk of preterm birth or low birth weight. So about 150 minutes per week of moderate intensity exercise. Think brisk walking, like hiking, swimming, prenatal classes, light resistance work, is safe and beneficial for most uncomplicated pregnancies. Hello, BIRTHFIT basics. Like, these are 15 movements and poses that every individual needs to be doing. So yes, you mama, yes, you coach need to be programming this. Yes, you practitioner need to have this in your movement bank, because this fits right into that moderate intensity exercise. Now, Dr. Margie's team also studied higher intensity exercise, including high intensity interval training, resistance work, and in controlled studies with healthy pregnant participants, maternal and fetal responses stayed within safe clinical ranges. There were no signals that brief bouts of vigorous exercise trigger pregnancy loss. So the conclusion based on her current research, which is just out like less than 2 years, y'all, is routine advice to avoid exercise for fear of miscarriage is not evidence-based. I just said that. So to every coach reading this, you can confidently guide your clients to move. If you don't feel confident in saying to your client, jump or run or lift more than 50%, that's fine. Get inside the BIRTHFIT coach program and we'll talk about it. But your clients need to be moving. Movement is life. To every practitioner, you can support appropriate exercise prescriptions without fear. And to every mama, your body was designed to move, even in early pregnancy. Now, I will put an asterisk here. So if you are going through IVF or IUI, I know that fear is kind of like driving the bus. I know that you wanted to be pregnant yesterday, and there's a lot of fear and anxiety. Even, excuse me, the IVF and IUI docs and clinics that I've worked with, they like the good ones. The good ones will continue to say, move, go for walks, get out in nature, do some gentle rehab movements, and get through the first trimester. So, BIRTHFIT basics, just what I said before. If you are working with an IVF clinic, IUI doc, ART, the overarching like umbrella term is assisted reproductive technology, that tells you to do nothing, that's bananas to me. They probably also did not check lifestyle factors before. So that would be time to change. Movement is medicine. It supports your health, your strength, your nervous system, your overall vitality. It does not threaten your baby. Okay, so this is what I wanted to hit on, and we'll start to wrap it up in just a second because I promised you short, sweet podcasts in 2026. All right, so what options are there? First, if you're experiencing a miscarriage, you're not alone. Like I said, I've experienced one. I know many other women that have experienced miscarriages. If you are a coach or a practitioner, please communicate with your clients that they are not alone and that what they are feeling physically and emotionally is real and valid, and they deserve support, information, and compassionate care. So here are 3 big options, maybe 4, but for sure 3. The first option, do nothing. This is usually labeled as expectant management, which means waiting and allowing your body to complete the process naturally in its own time. This can take days to weeks, but some women choose this path to honor their body's innate wisdom. The second option is Western medicine, which is the more common route we've heard of, or most of us have heard of. This typically involves pharmaceutical intervention, some sort of medication like misoprostol, or surgical intervention like a DNC. It's like that's a surgical procedure to remove the tissue. Both have their place, and you can discuss the pros and cons and timing with your provider. Just remember, like a surgical procedure comes with scar tissue. All right, option number 3, alternative and complementary. So many women find support through acupuncture, homeopathy, herbal medicine, naturopathic, and other traditional healing modalities. These can be used alone or alongside medical care or alongside the expectant management. So as I shared, I allowed the pregnancy to release on its own. I also utilized acupuncture, which I thought was really complementary to my just wait and allow my body's innate wisdom to do what it's going to do. Um, yeah, my acupuncturist, when I first started experiencing some bleeding, she did a like a I'll just call it an exam, but she checked me out, and she basically said, this pregnancy is going to stick or it won't stick, but we will optimize you. And I really appreciated that honesty. And one of the books that I had read prior to even conceiving was Spirit Babies. And I went back to that book and I thought it was just a great read at that time. So maybe that book helps you. Option four, which can be complementary to the other ones, I also leaned a ton on my mindset practices and my prayer practices. And when I finally accepted that my first pregnancy was not going to term, I thanked the spirit baby for choosing me to be his vessel. I really felt like it was a male spirit. I said a prayer to God to carry me and baby through this process and to hold my heart and my mind. And the next few days, the pregnancy was fully released from my body, almost like I had given it permission. All right, so I share all this. I share my personal experience. None of it's medical advice. It's there for educational purposes. And I share my story because we learn through stories. And I want you to consult a healer you trust, tap into your inner wisdom. And I want you to consider all the ways that you can and need to be supported. Western medicine is not the only path, although it is a path, and it may be the right path for you. But please tap into your intuition because that matters. Your spiritual practices matter, and your body's wisdom. Oh, our bodies are so wise. So, moving on. If you're experiencing miscarriage, if your client is, this is a loss and it deserves to be acknowledged. It is not something to whisper about or hide. It's not something that you caused or, um, you know, the blame game. It's not something you have to navigate alone. It is what it is. And your story matters, your body's wisdom matters, your intuition, your spiritual practices, your grief, your healing. So I want you to find some way to honor this pregnancy, honor this loss. And usually, when women have time and space to honor this loss, it completes the chapter. But when we brush this miscarriage under the rug and we don't talk about it or we hide it, then the grief often shows up in the next pregnancy as anxiety, as fear. And within that next pregnancy, many decisions are made from a fear-based mentality, from choosing fear to drive the bus instead of love. And each pregnancy, I want you to treat as an initiation. Each pregnancy is its own chapter. There's something to be learned in each pregnancy. So I just want you to take that with you, whether you're a mama or a coach or a practitioner. Yeah. At BIRTHFIT, we are committed to supporting the whole motherhood journey. And this does include these heavy parts, these hard parts. And like I said, if you are experiencing a miscarriage, you are not alone. You are not broken. And I want you to know you are held. So much love to you. If you're going through this, I'm sending you love from my heart to you, I'm sending a big prayer up for you. If you're a coach or a practitioner and you are supporting women through pregnancy and postpartum, You need to be equipped with this information, and you need to know how to serve the whole woman, the whole picture, from the nervous system perspective, alternative options, spiritual dimensions. And, I've spent over a decade, close to 12 years, building evidence-based, nervous system focused approach to maternal care that fills the gap between medical and fitness industries. And that is why I'm so passionate about training coaches and practitioners to hold space for women with confidence, compassion, and clinical excellence. So if you have not taken the BIRTHFIT coach course, get in there, y'all. Like, get in there. This is an example. Miscarriage is an example of how you can step up and show up to be a better leader and a better practitioner, a better coach inside of your community. All right. That's all for today. Please, please, please go to iTunes or Spotify, wherever you listen at, and leave us a review. It would mean a lot. If this episode touched your heart, please share it with somebody. If you know someone, a woman that's going through a miscarriage, please share it with her. I know, like I said, it doesn't get talked about enough. All right, y'all. So much love. I'll talk to you soon.